Haylea Mannebach again. And it's September 17th, and this is going to be my skeletal presentation, our skeletal system presentation. So before I identify all bones, I'll first talk about the components of the skeletal system, the main component being bone, but there's also other components like ligaments and tendons, joints, and cartilage that also make up the skeletal system. Bones themselves have three distinct, main features of them. Bones are made up of many different types of cells, but the three main features of bones are they all have a periosteum, which is the tough outer layer of the bones that cover it and protect it. Then it's also made up of compact bone, which is the white, hard, smooth part of the bone that really creates the structure that how we're able to hold our weight and walk and run and sit and everything that requires a lot of strength comes from the compact bone, and the spongy bone has some more holes in it than the compact bone in order to store bone marrow. But all three of those components make up bones along with others. Those are the three main. And then other components of the skeletal system include cartilage. And cartilage is a smooth, flexible substance that you put between the bones at joints where they meet to reduce the friction and reduce pain so that we're able to bend and move our joints. Which brings me to my clinical application for this video. Arthritis is something that occurs in joints when that cartilage starts to degrade or you start to lose that cartilage in between your joints, which causes inflammation and pain for the patient. A lot of the treatments that you can do for that are corticosteroid injections, which help with inflammation and the pain. We could do oral anti-inflammatory medication, but once it comes to such a severe point where you have bone-on-bone arthritis, where there's really no cartilage left, the best thing to do for that would be either get a total knee replacement or a total hip replacement, depending on the type of joint that you're looking at. So those are the other two components of the skeletal system. I'm touching on the cartilage and joints, but there's also ligaments and tendons. Ligaments join bones together. They're bands of connective tissue that join bones together, and tendons are bands of connective tissue that join muscle to bone. So bones themselves can be classified up into 7 different classifications based off of their shape. So I'll discuss them now. So the first one is the sutural bones. Sutural bones are small, flat, and oddly shaped. They're found in between the flat bones of the skull along the sutures. Next type of bone would be the flat bones. Flat bones are found in the skull as well as other places. They're normally thin, and they roughly have parallel surfaces made up of compact bone with spongy bone in the middle, kind of like a sandwich. And like I said earlier, they're found in the roof of the skull, as well as the sternum and the ribs and the scapula. A direct example of a flat bone would be a parietal bone in the skull. So after that, we have the pneumatized bones, which are known for being hollow, or they have an increased amount of just hollow places in the bone. An example of this would be the ethmoid bone. After that, we have short bones. Short bones are box-like in structure. The outer or external surface of the bone is made up of compact bone, and the internal structure of the bone is spongy bone. Examples of short bones would be either the carpal bones or tarsal bones in the hands or feet. And then after short bones, we have long bones. Long bones are relatively longer and more slender. All long bones have a diaphysesis, which is a long shaft. They have 2 metaphysesis, 2 epiphysesis, and a medullary cavity. An example of long bones would be a humerus or a femur in your arm or your leg. And after long bones, we have sesamoid bones. Sesamoid bones are small, flat, and round shaped, and they're normally found near joints. So the patella is an example of a sesamoid bone. Lastly, we have irregular bones. Irregular bones are complex in structure with varying surfaces. Could be rough, smooth, rigid, notched, short. It's really it could change kind of bone to bone, and the internal structures are equally varied within irregular bones. Example would be vertebrae within the spinal column is considered the irregular bone. So those are the 7 classifications of bones. So now I'm going to use a little skeleton to identify the bones. So I'll start with the axial skeletal first, starting up at the head with the cranial bones, and then move into the appendicular skeleton. So we have the occipital bone in the back of the head, and then we have the parietal bones on either side of the top of the skeleton, and then we have the frontal bone. On the side, we have the temporal bones on either side. In front of the temporal bones, we have the sphenoid bone. In front of that bone, we have the ethmoid bone, kind of like behind the eyes. And those make up the cranial bones, the cranium bones. And now for more facial bones, we have the nasal bones in between the eyes. And then once in between, it's hard to see. We have the nasal bones, and then we have the lacrimal bones behind those nasal bones, and then behind that is the ethmoid bone again. Further into the skeleton, or the head, more towards the palate, we have the palatine bones. These cheekbones here are known as the zygomatic bones. We have the maxilla on either side of the lip area. Within the nose, there's below the perpendicular plate of the ethmoid bone, we have the vomer, and then on either side of the nose, we have the inferior nasal concha, and then we have the mandible down here, and below it there will be a hyoid bone up here, and then there's 6 auditory ossicle bones that are within the temporal bone, and that makes up really all of the bones of the facial structures. And then moving on from the cranial bones, we have more axial bones moving to the vertebrae column, the spinal column. Up top, it's broken up into 4 sections: the cervical section, thoracic section, lumbar, and sacral. The cervical section is up by the neck, so each vertebrae is labeled C1 through 7. And then the start of the first rib starts the first thoracic vertebrae, so T1, and labeled all the way down through T12. There's 12 ribs corresponding to the 12 vertebrae in the thoracic section, or thoracic cavity, thoracic cage. And then moving down to the lumbar section, we have the lumbar section. There's L1 through L5, and right below L5 is the sacrum, and then the coccyx down here. And then in front, still on the axial skeleton, is the sternum and the ribs. There's 24 ribs, or 12 sets of ribs. Sets 1 through 7 of ribs are considered true ribs because they are connected directly to the sternum by costal cartilage, and it's a 1-to-1 ratio, so 1 rib to 1 costal cartilage to the sternum. Ribs 8 through 10 are considered false ribs because they all kind of share costal cartilage that then takes them to the sternum. And ribs 11 and 12 down here are considered floating ribs because they are not directly connected to the sternum. And those are all the bones that make up the axial skeleton. So moving on to the appendicular skeleton, we have the clavicles up here, and then the scapula in the back. We have the humerus, and then the radius, and then the ulna. And now working towards the carpal bones. Starting at my left, there's the sphenoid bone, the lumate, the lumate bone, the sphenoid bone, the scaphoid bone, the lumate bone, can't remember what that one is, the pisiform bone, and then the humate, capitate, trapezoid, and trapezium. Oh, the triquetral. There's the triquetral bone next to the lumate bone. And then below those carpal bones are the metacarpal bones. And then below those are the phalanges, and you have goes from proximal, medial to distal phalanges on each of the fingers. And that is mirrored on both hands. And that makes up the upper limb bones. Moving on to the lower limb, we have the hip bones, which if you look at it laterally, the hip bone is made up of 3 different bones: the ilium, the ischium, and the pubis. We have the humerus and the fibula, the tibia. We have carpal bones in the bottom here. We have the calcaneus, the talus, navicular, the cuboid, the lateral, intermediate, and medial cuneiform. And then we have the metatarsals, then the phalanges again, separated into proximal, middle, and distal for each of the phalanges on each of the toes or the feet. And that makes up all of the bones to the system.